Is it streaming now? Okay.
Mm.
Hello, everyone. Welcome to an online virtual session with Dr. Barrett. And thank you for taking your time today to come to our session. And whenever you're ready, you can free to take it away.
Okay, well, thank you. I'm going to talk tonight a lot about aesthetics in dentistry. One of the things I'm passionate about is doing cosmetic dentistry. So hopefully, you'll see some things maybe that you haven't seen before. It'll give you maybe a little flavor for what a cosmetic dentist does. I'm going to show you a lot of before and after pictures, hopefully things that just kind of get you motivated to be a dentist. Because what I'm going to show you is going to be different than the type of things that you're going to experience when you're in dental school. I do want to share with you my Instagram. If you guys want to see a lot of before and after cases, videos, feel free to follow me. I try to post things pretty regularly on cases that we're working on. Also, if you guys have any questions, feel free to use me as a resource. This is my email address, or send me a message on Instagram. There may be things that down the road you'd like to ask me, and based on my experience, which I'll kind of review with you, I may be able to give you some guidance along the way, and I'm certainly happy to do that for you. So everything I'm going to talk about tonight is really based on my experience. And every dentist has a different background. They come from a different school, maybe a different GPR, a different residency. So, based on my experience, I see things a certain way. And I think every dentist starts to develop a way of seeing teeth in the mouth, the way they see smiles, their thoughts about what kind of dentistry they want to practice and what environment they want to practice dentistry. So everything is just really my perspective. It's from my point of view. I'm going to talk a lot about developing your vision for dentistry and how you see things. And everybody does interpret things a little bit different. So I graduated from the University of Pittsburgh, where I did my undergrad. And then I went to Case Western Dental School, which is in Cleveland, Ohio. And after dental school, I joined the Navy as a dental officer, which I served 3 years as a dental officer. So my first stop as a dental officer was in Orlando, Florida. And at that time in Orlando, it was the second largest Navy base in the country. It was really for recruits coming into the Navy. And we had 50 dentists on the base with us. And that base no longer exists anymore. But at that time, it was very, very busy and a lot of dentists there. And then during my third year in the Navy, I got sent to the USS Saratoga. And that was an aircraft carrier. And this is actually my aircraft carrier going through the Suez Canal. So this was back in 1990. And I did spend 1 year on the Saratoga as a dentist. And unfortunately, I got to the ship, and then 2 days later, there was a war that broke out. So you guys, may be familiar with Desert Shield and Desert Storm back in 1990. And my aircraft carrier just sailed right across the Mediterranean through the Suez Canal and into the Red Sea, and we took part in that war. So as a dentist, that's a very unique experience because you really don't see patients when that's happening. This is actually my dental assistant, and you can see he's not very energetic because we're not seeing patients. And so in the Navy, it's kind of a different animal as far as dentistry. You're really a dental officer first, and then you're a dentist. So I had a very unique experience. So what I did mostly to keep busy is I loaded bombs on planes. And my dental experience was really curtailed pretty dramatically. I didn't do any crown and bridge for the 3 years I was in the Navy. And I was out to sea for about 7.5 months before we got back into Jacksonville, Florida. And when I got out of the Navy, I joined Greenberg Dental in 1991. And at that time, we had just 2 locations. So we had at our Altamont Springs, we had one little star on the map. And we currently have 85 locations in Florida. So we've grown quite a bit over the years and have kind of spread our wings throughout that corridor in Central Florida, through Jacksonville, Central Florida, Tampa, Sarasota, and down into South Florida. One of the things I like to mention about Greenberg Dental and Orthodontics, and if you guys have a question later, I'd be glad to answer. this is going to be important to you when you graduate. And so I think it's important that now you start to understand what are practice makeups, how's a practice developed. There's different kinds of practices. There are, fee-for-service practices, there's solo practitioners, there are group practices, and there's different kinds of group practices. Greenberg Dental is a privately owned general dentistry and multi-specialty group practice owned and operated by dentists. Again, I don't expect this to mean much to you right now, but it will at some point as you start looking for employment after you graduate dental school. You're going to want to know what is the makeup and who actually owns the group that you may be working for, as increasing number of new graduates are now working for large groups. It would be very important for you. What's important about our group is that we do have specialists integrated into our group. And specialists integrated with the general dentist are very important because it allows us to do interdisciplinary cases. So those are cases where you're going to use maybe a general dentist, an orthodontist, maybe a general dentist and a periodontist work together. And sometimes you have maybe 3 specialists involved in a case. And when you're all under one roof, it's very similar to how you're going to work in dental school, except the cases that we're going to work on maybe are going to be a little more advanced. But from communication, you can imagine how easy it is when we're all in the same building and we're able to talk to each other. So just give you an example of what an interdisciplinary case looks like. This is one of my patients, and she had some implants done. She had to have some teeth removed that never erupted into her mouth, so her canines. And then she had bone grafts done and she had implants placed by the oral surgeon. She then also had some orthodontic treatment that was done, and that was done by our orthodontist. And eventually I was able to do the implants for her. And so she just has 2 implants. And you can see the dramatic difference this makes in someone's smile when you're able to do something comprehensively. Even though you're only working on a few teeth, it can be very, very dramatic and life-changing for many people. So I am one of the founding partners of our group. So from back when I started in 1991, and I'm also the clinical director. And so as a clinical director, some of my responsibilities are to visit the dental schools in Florida. And I do visit them at least once or twice a year. And I do programs at the school, a lot of lectures, business lectures and aesthetic lectures. I do interview and hire all of the all the general dentists that we do hire in our organization. I do interview them and hire them. And I run our in-house CE program. We do a lot of courses for our doctors online, and we'll get back to doing in-person courses as well. One of the things that we've developed within our group is what we call our accelerated learning program, which actually was featured in Dentistry Today, which is the largest dental publication in the country. So we were on the cover, and our program was highlighted last March of 2020. And we really focus on cosmetic dentistry within our group. We focus on those interdisciplinary cases because we do have the specialists within our group. And then the main thing I do day to day is I work chairside with our doctors. So I cover the entire state of Florida, and I'm in a different office every single day. So this morning I was over in Tampa, which is about 2.5 hours from my house, did a case with a doctor, spent the day with him, then drove back home to be here with you. So I get a lot of experience working with young doctors when they graduate dental school, which really gives me kind of a unique perspective in how to help train them a little bit better. I am a faculty member at LECOM. I work with the junior students in their clinic. So that's going to be pretty exciting. I started about a month and a half ago, so I'm really looking forward to getting started next week when they get back into the clinic. I am what's called a KOL, or a key opinion leader, for Glidewell Laboratories. I do speaking for them at their national symposium every year, typically on aesthetic cases, provisionals, veneers, crowns, those type of things. And I have done plenty of articles in the Chairside magazine on aesthetics. This year, just about a month ago, I won the American Academy of Cosmetic Dentistry Portrait Smile competition. And that was really kind of a big deal for me because photography is really a passion for me. And I think if you're going to do aesthetics and you like to do that type of dentistry, you're going to need to become a good photographer. You're going to need to make that investment in time to learn how to take these pictures and use them to treatment plan and communicate not only with your patients, but also with the laboratories as well. And so these are some of the national webinars that I have done on aesthetics, whether it be provisionals, whether it be smile design. And some of these principles I'll share with you tonight, certainly on case acceptance. And this is the little studio that I have in my office where I do take pictures. And then I also travel with an entire set of lights and things that I move to every office that I visit. I carry them with me so I can set them up, which takes about 20 minutes, and I can take photographs just about anywhere. So tonight we're really going to talk about dental aesthetics. We're going to talk about some terminology. We're going to talk about how you look at a smile and what makes it pleasing. And it's probably going to change how you look at things. And so hopefully some of these terms that I mentioned, some of the things will stick with you as you go through your dental school career. I always say that, you know, I love aesthetics because a smile never goes out of style. It's always been important throughout dentistry, and patients love to have a nice smile. That's never really changed. Kind of the same strategy that they use at Amazon, right? Jeff Bezos had the saying that base your strategy on things that will not change. So aesthetics is never going to change. It's always going to be important to patients. And I think especially now more than ever, they want to look good, and you can help them, and all of you are going to have that ability to do that for your patients. Typically what you don't see, I mean, you see pictures that I show you, and you may say, wow, those are nice pictures. That's a nice case. That's great. But I can assure you that you're all going to go through all of the hard work, the failures, all the disappointment that goes into making that work. It is a long process, and it's going to take some dedication on your part to decide if that's what you truly like to do. Then you're going to really need to be dedicated to it. And things don't always work out the first time, right? As a dentist, it's a learning curve that you have to go through. So hopefully, when you get out, you'll have a great mentor that you'll be able to practice with that really will decrease that learning curve for you so that you don't have to make those mistakes on your own. So when we talk about aesthetics, it's really kind of a combination of beauty and following a set of principles. And as a dentist, you're going to be an artist. And I know a lot of you maybe won't think of yourself as an artist. I certainly don't have the ability to be an artist. I don't draw well, but you will develop your mind's eye, and you will start seeing things that you know are going to look good because you're following a set of principles. And we're going to talk about some of those today. So where you take a patient like this, and we're going to do veneers on this patient. So these are 8 veneers. And we don't always have the ability to treat every tooth in the mouth because it's expensive for patients. We're always trying to work within the patient's budget. So in this case, I was limited to what I could do, but for what we did do, we made a life-changing event for this patient. And you really can reflect that when you take photographs. You can see it in her eyes when she smiles. And so those set of principles that really help you to unleash your artistic ability, which I assure you all of you do have. We call those protocols. And in your office, for whatever procedures you're going to do, you're going to have protocols that you follow. For me, those protocols or that system, it's very important that it yields a very predictable outcome. Because as a dentist, you know, patients aren't going to pay you to do things over and over again and be trial and error. So you want to know that those protocols, those systems that you have in place yield predictable outcomes. And what I've noticed over time is as doctors follow that, especially young doctors, they tend to build a level of confidence in themselves and what they're capable of doing much faster. So really our goal in my group and what I work with our doctors on is to follow these principles to get these predictable outcomes, to help young doctors become more confident in what they're doing day in and day out. So for me, the protocols that I follow, there's an entire list of them. What I highlighted are just some of the things that I'm going to talk a little bit about tonight. And you can see how many times the words photography and video kind of pop up, because it's in 2021, if you're not practicing with a camera and not a cell phone, but a really nice camera that takes quality pictures, you're not really going to be able to do the aesthetics that a lot of patients will pay you to do and will come to your office and ask you to do as a dentist. So, also what I don't have kind of in my protocols is a digital scanner, which I'm sure a lot of you may be familiar with. Digital scanners are becoming more commonplace. They're probably in about 20% of dental offices currently. I am implementing them within my offices currently, and I've tested a variety of them. They have really many useful indications for what I do. So this will be a great addition to kind of our protocols. And a lot of the things I'm talking about, when you're in dental school, because of the nature of dental school and because I'm in dental schools and I see dental students all the time, I understand what you do on your patients. And you don't have the ability necessarily to experience some of the things that I'm going to show you tonight. Nonetheless, if it kind of strikes a passion in you, there are lots of things that you can do throughout your dental career while you're in dental school even to learn about this and kind of be prepared when you get out so that you can broaden your horizons. This is just some examples of how I take my photographs on my patients. You can kind of see this is a little video shoot. And this is a young patient. She's 17. And she actually does she's a professional model. She models wedding dresses. And she's very comfortable in front of a camera, as you can tell. I take a lot of pictures. It's not uncommon for me to shoot 300 to 400 pictures on a patient like this within a matter of 25 minutes. It's really easy. And so some of the pictures that came out of that photo shoot that you just saw are these after pictures. And she had some serious dental concerns. She had some discoloration on her teeth. She had fillings on every single tooth on her upper arch. And so all of her upper teeth needed to be treated in conjunction with some periodontal treatment, where those little short teeth that you see kind of in the back of her mouth, where we elongated those so she could have a broader, fuller smile. So that's a procedure called crown lengthening that you might be familiar with. And I did that in conjunction with our in-house periodontist to get this result. And so I think she's pretty happy with it. And you can really capture that when you take some nice photographs. So in my signature, and this is kind of a logo that I use all the time, under my name, it says Vision First. And we're going to talk a lot about that because vision first is very important. I teach doctors all the time, and hopefully you'll remember this when you're in dental school. In dental school, you're going to be very concerned about procedures. How do I do a filling? How do I do a crown? How do I do an extraction? And it's very difficult to develop your vision on how do you see teeth fitting into someone's face? How do you look beyond just one tooth? And then how do you communicate that? So I strongly believe that young doctors, when they graduate, they need to develop their vision first. Clinical skills will always happen just through repetition. You do enough fillings, you do enough crowns, you're going to get very good at it. You're going to get fast at it. You're going to be much better than you are at day one. But if you never spend time to develop your vision and how you see teeth fitting within someone's face and work on those communication skills, then I always say you're going to stay a one-tooth dentist and you're never really going to expand past that. So developing your vision means that you start with the end in mind. So every time I see a patient, I'm already trying to envision what are they going to look like when I'm done. And that's your job as the dentist to guide them through that process. To develop your mind's eye so that you can see these things before you ever do them. And then vision first photography really has a lot to do with clinical excellence. You want to photograph things. They're going to allow you and help you to, if you use it properly as a tool, to be better at what you do, because you're going to see the mistakes that you made. So I always think that photography and video are used for a lot of reasons in a dental practice. And maybe you've shadowed in practices. Maybe they've talked about this, maybe they haven't. I don't know. But photography is really useful for documentation. It's very important that you need to cover your own, CYA means, cover your butt. You want to protect yourself. So documenting what you do is very important. Photography does that. You need photography to communicate, like I said, with your patients. You need to communicate with a laboratory who's going to design and help you with the case. And ultimately, you need to communicate with your staff. So communication is very critical for what I do, and finding an easy way to do that, and I use photography all the time. Having a camera taking pictures gives you instant validity with patients. You don't look very professional when you're sticking your cell phone in someone's face trying to take pictures of their teeth. So having the right tools makes you more professional maybe than you are at that point in your career. It gives you that predictability that you need. It helps to build confidence. For sure, self-improvement is the biggest thing that I get from photography. I still look at every case that I do, and I don't know that I've ever done a case where I haven't found something looking at the photographs that I wish I would have maybe done a little bit different. And then ultimately, you can use it to market yourself as a dentist, whether you do Instagram, whether you do videos, whether you do anything in the community on your website. Things that you are doing yourself is far more valuable than trying to promote yourself with things that other dentists have done, and you're playing off of, products that they've produced. So I think that once you develop vision, you change the way you look at things, and the things that you look at will change. So when we talk about a smile, I'm going to walk you through a case. I'm going to point out things to you and give you some terminology. And hopefully next time you look at someone that you might meet, or even a photograph in a magazine, you start to notice things in their smile and what's right or what's wrong with it. So just to give you an example of why I think photography is so valuable in dentistry. And I know this may not make a lot of sense to you at the moment, but if you look along the bottom on that red line, a lot of dentists will do a single tooth. You'll do a crown on a broken tooth, and that's fine. And you may do some fillings. And on the far extreme, you may do smile makeovers, or what we sometimes call complete care, where you're rehabilitating an entire patient's smile. And so they're very different, not only on an economic scale about what the patient pays, but also what you earn from doing that type of work. They're very, very different animals. And if you look on the other axis, if you do that emergency treatment, there's not a lot of emotional appeal that necessarily patients are invested in, as opposed to as you kind of go up the ladder where you get to emotional appeal, where patients really look at a photograph, they look at a picture, and they go, I want that because that makes me feel better about myself. And it's very useful to have those tools with you, because people, and you may have heard this before, and patients are like anyone else, they typically buy on emotion. And make no mistake about it, you are selling your dentistry. You may not like that term selling, but you are selling a treatment plan. You're selling a new smile. That's what you're doing. Now, it may be the right thing for the patient because they have a lot of decay. They need to have that done, but it's still selling. So you can take no pictures, or you can take really bad pictures from your cell phone, and you can try to communicate the type of dentistry that you're all about that way. And I think that really hurts you. It kind of keeps you in that category where you're doing single teeth. You're doing back teeth that may not have the same aesthetic or cosmetic appeal. And that's fine. And we do that a lot. We do single tooth dentistry. We do emergency treatment every single day in our practice. But a lot of dentists want to do some bigger cases. They want to do those aesthetic and cosmetic cases. They want to get better at it. And so you can use some other doctors' work, and a lot of doctors make smile galleries, and you can buy a before and after book and you can put it in your waiting room. But when you show pictures from a book like this to your patients, it's not work that you did. And what I find when you speak about those cases, you really lack the passion that's there when it was actually your own patient and you made that life-changing result for that patient. And so you talked totally different. You can use close-up pictures for patients, and I think that's great. And so you can have a great result, and you can use this to point things out to your patients. This is where you are now. This is what we could do for you possibly. And you start moving to more towards complete care and doing more smile makeovers. Or you can learn to take some really great portraits and use some before and after videos to help you, because that smile before and after is what patients want to have. They see not 2 implants in there, they see a whole new person, a new outlook, a new personality that's kind of emerged. And that's what they look for. So I do my own smile gallery books, and these are in my office. I actually put fees in my books so patients know what things cost. And certainly that's different all over the country. It depends on what kind of labs you use and what your philosophy is on dentistry. So that's maybe a whole nother discussion that I would love to come back and we can always talk about later. But these are some of my patients, right? From young people, some are veneers, some are crowns, to an elderly couple on his 80th birthday. We fixed both him and his wife and then shot these photographs of them. So everything that I'm showing you, every case and every photograph, I personally did the dentistry and I also took the photography. And so let's look at some terminology and let's just talk about how you look at a smile and what are those terms that dentists use amongst each other. And so it's very common if you read an article or look at a magazine, you're going to see things that refer to global aesthetics, macro aesthetics, micro aesthetics, pink aesthetics, and white aesthetics. And I'm just going to pinpoint some of these things for you. Because when you're in dental school, I always say dental school teaches you to cross your T's and dot your I's, because they only have limited time with you and they have so much to teach you both didactically and then clinically and get you comfortable. It's a very long process. And now that I'm in the school more often and the years that I visited and I lectured at the school, I kind of forgot, because I graduated a long time ago. Things take a long time in that dental school environment. When you get out of dental school, you learn calligraphy. You learn to do the fancier things, the things that you really motivate you and kind of get you out of bed in the morning and make you excited to be a dentist, because it's a long career and you're going to practice for 30, 40 years is an average practice time for a dentist. So hopefully you really learn to love what you do. So we're going to look at Bella, and you've seen Bella tonight. She's one of my patients, and Bella, just so you know, she had 8 teeth restored. She, as an actress, she lives in Chicago. She flew into Jacksonville, Florida, for me to do her work, because she spends a lot of time doing plays, some commercials, and she really wanted a big, brighter, whiter smile that was visible on a big stage where there's a big audience and lights on her. And so this is where we ended up, but let's look at some things and talk about it. When you talk about global aesthetics, you want to look at someone's face as a whole. We look at the shape of their eyes. We also actually look at some of the color of their eyes, not the blue, but we look at the white. And that can be very useful to help us match the color and the shade of the teeth. Now, a lot of dentists don't use that as a tool. I don't use it all the time, but it is a tool that you can use. It's really important to look at the lips. Everybody has different lip structure. And how does the lip move? So we want to look at everybody's lip. And I will show you different patients, and you will start to see people that have asymmetrical lips. And so when you put teeth within someone's mouth where their lips are asymmetrical, meaning they're crooked in some way, they will very much so make the teeth appear to be off when maybe the teeth are exactly right. And then the lips are the problem. So you want to do an unretracted smile. You don't want to put retractors in their face. You don't want to put your fingers in there. You want to take a nice picture of their face and you want to evaluate it and use it to plan the case that you're going to do. Every face is unique, and you want to look at the orientation within the face. So if we look at Bella, one of the terms you're going to hear all the time is interpupillary. That's a line between the eyes. And that is a horizontal reference that can be used in a lot of patients as a reference, to go ahead and restore their teeth. Now, people don't always have symmetrical eyes, and you probably see that if you really look at people closely and they hold their head very in a neutral position and you look at their eyes, one is typically higher or lower than the other. But in about 88% of the cases, this is what we're using as a reference point. And it's very important to take a photograph where the eyes or the head is level. And if the head's level, you're going to find out if the eyes are level. So it's important to know this. The second most important line is something that's called the inner commissure line. And so the commissures are the corners of the mouth. So I have those two yellow vertical lines. Those are the corners of her mouth. Those are her commissures. And if I draw a line between them over the top of her upper lip, you can see that that's very symmetrical in parallel to where her eyes are. So if those two lines match, you have a patient that's very symmetrical. Her case is going to be easy to design. And hopefully, if you're, as a dentist, do a really good job and you have a great lab, you're going to get a really nice result. Some patients are not so easy. And for some patients, you're going to have to look at some kind of average between these lines and try to figure out what do you match, because their face is not symmetrical in any way. So this is a patient of mine, and this is a picture, and this is a video. And I take video because I want to see how they talk and they look in a very dynamic environment where they're moving and talking and acting very normal rather than a static photograph. That could be more valuable. And a lot of times I'll just freeze that picture. But already, if you look at this picture from what we just talked about, you can see that her eyes are not symmetrical, right? You can see that her inner commissure, and if I draw that line across the top of her lip, that is not nearly symmetrical or parallel to her eyes in any way. It's in a total different position. If we catch her just in conversation, we can see that her eyes are not level. And that commissure line really even looks worse now. And if you look at how the teeth are positioned in her mouth on an angle, these are all things now that you have to start to think about as you're designing and trying to develop a treatment plan for the patient. It may be more complicated than you think. And so photography and video help you. When you look at teeth and you're drawing these lines, it's very important to look at the midline. So I have her horizontal line between her eyes. I have a vertical line. It's right between the eyes, right in the middle of the forehead. It goes down through the tip of her nose. And Bella is very symmetrical. Some people have their nose shifted way to one side, left or right, and they're not symmetrical at all. But as I draw that line through her teeth, I think most of you can tell that the midline between her front two teeth, which are teeth numbers 8 and 9, that line does not bisect the middle of those teeth. That means her midline is off. Her midline is moved slightly to her right. And that's a function of when she had her braces and where they finished her teeth. That's okay. That cannot always be fixed, and it doesn't have to be fixed. What's important is that you don't create a cant in her teeth. And the word cant means that the teeth are not straight, that they are angled, right? And so if those teeth are angled, it's going to be very, very noticeable when you look at someone's smile. So you want the midline to be as centered as possible, and you want that midline not to have a cant. It needs to be straight. So do the teeth in her mouth, and these are crowns that Bella has, do they follow the anatomy of her lower lip? So that yellow line that shows the curvature of her smile, right? That's a very natural smile for someone. And your teeth should follow that, which means the front teeth, 8 and 9, the two front teeth are a little bit longer. The teeth on the side get a little bit shorter, and they progressively follow that curvature that you have. If you don't have that, if the front teeth are shorter and they go opposite of the lip, meaning the front teeth are short and they go this way, that's called a reverse smile. And that can be very unattractive. And a lot of patients don't know that they have a reverse smile until you point it out to them and you help them envision what it would look like if you correct that. So the incisal edge position, that's the very edge of her front teeth. It really should be straight. It should be parallel to her eyes. That would be a really nice case. And in this case, in Bella's case, the reason her her smile looks so nice, it is very parallel to her eyes. And it should gently rest against the lower lip. So not only cosmetically is that important, that's important in speech. And you will test as you work on teeth, your patient's speech, how they say the word F. If you say the word F, your front teeth gently press against the inside of your lower lip. If your teeth are too long, if you make a mistake, patients are going to tell you they can't say certain letters. So you'll learn to evaluate how they talk. And that could be very, very useful. So again, if we go back to our patient who's not symmetrical, and we look at her lower lip, and we look at her eyes, right? And then we look at the edges of her teeth. Do her lower teeth, or her incisal edges, they're in no way parallel to where her eyes are, right? And the incisal edges, the way her teeth are, they don't follow that curvature of her lower lip in any way. And if you look close up at her teeth, you really kind of get an idea of the challenges that she has. And so these are cases that when you graduate dental school that you're going to be faced to do. And while you're in dental school, you're not going to have experience being able to do this, which is why it's important while you're in dental school, take advantage of dental meetings that you can go to, online seminars that you can join in, where you can really start to see and envision these cases and learn how they're done. That's going to help you develop your vision for when you graduate dental school. So we can look at some global aesthetics. Again, we're using that upper lip as a guide. We're using those, that inner commissure line, that's the upper lip, and everything's parallel. The incisal edges to her teeth, those two blue lines, very parallel, they look great. In someone's smile, those little dark areas, that's called your buccal corridor. That's the negative space, the dark area in the smile. A lot of patients have a lot of negative space. It will seem like they have no teeth in their mouth because the teeth are pushed inward and there's no light back there and you just see shadow. And so it's very common as you're developing smiles for people as you build out their buccal corridor and give them a wider, broader smile. So if we look at macro aesthetics, we're going to start to look a little more closely at the teeth. And really macro talks about the shapes and the contours of the teeth themselves. We're moving away from the face and we're starting to look at teeth. And we're looking at teeth and the gum tissue because that's really very important. So I'm just going to give you a couple of terms. Gingival embrasures are those triangles on the top. That's the space between the teeth on the top where the gum tissue kind of fits in. And the incisal embrasures are on the bottom. It's those little dark spaces between the teeth. And you can learn to customize those spaces and individualize your patient's smile. So we even have forms like this where you can see the edges of the teeth all are a little bit different, the shapes. Those are little nuances of the embrasures that you as a dentist can tweak chairside with your patients, and you can help to individualize their smile that you're creating for them. When we look at the teeth, we look at the size of the teeth. And I'm just going to give you some averages. You can just kind of keep this in mind that the width to height ratio of a tooth is typically 80%. So if a tooth is 10 millimeters tall, it should be 8 millimeters wide. That's a very pleasing tooth size. So we're constantly measuring teeth to try to decide how are we going to change that patient's tooth? Are we making it taller, wider? And if so, how are we going to do that? An average front tooth is 11 millimeters. When we look at the soft tissue around the teeth, that sometimes can make a case very successful or it can make a tooth look disastrous. So it's important to look at the soft tissue. It has certain parameters on where it needs to sit. And sometimes that's why we use a periodontist and adjust that soft tissue so we end up with a more pleasing smile. And so the papilla, that's that little pink area between your teeth. It's very important that you maintain that and you keep it in its position and you don't damage it as a dentist when you're working on teeth because that will affect the outcome dramatically. And contacts are those areas that touch between the teeth. They're all different sizes And that's influenced dramatically by those little embrasures that you create, and the lab can create them for you, but you certainly can modify them. And that again leads to the appearance of the teeth. Pink aesthetics is nothing more than just looking at the gum tissue. Imagining that that gum tissue or the teeth are not there, and is the gum tissue symmetrical? Is it where it belongs? And if it's not where it belongs, how do you change it? You can use orthodontics to change gum tissue by intruding or moving teeth. You can use a periodontal procedure to move that gum tissue. So again, macro aesthetics, as we get really close to the tooth, the main thing that you're going to be concerned about as a dentist, and why I use photography, is you're going to need to communicate color to the laboratory, because color is very important. You have the patient in front of you. The lab has nothing to go on but the words that you write on your lab prescription or the photograph that you send them. That's all they have. They don't have a body. So I don't have to go over all of this. You can kind of look at some of these terms, but color is hue, chroma, and value. And of those things, value is going to be the most important to look at. So a lot of times I will use black and white photography, and I will look at the value of something because it has to do with the brightness. And there are cases that if the value is wrong, the laboratory technician has to redo it. There is no way for you to correct it. Some of the other things you can correct at the chair. So just to give you a dramatic example, this is a case where there's some implants in there, and you notice right away that the two teeth on the sides of the front ones are very, very dark gray. That's because the dentist that did this case missed the value. He picked the wrong shade and value for the laboratory and did not communicate that properly. So the technician who has no patience, no patient in the chair, no body, just a photograph or maybe just a written lab prescription, there's just words only, missed this, and this had to be redone. Teeth also have texture. They have a finish, a luster, and a reflectivity within that tooth that can be individualized for your patient. And that's up to you as the dentist to decide, not only on the shade and the texture, but what do you want it to look like, and how much reflection do you want? How much luster? Where do you want the light to bounce off the teeth? And that's why photography is important, because you see light bouncing off of teeth from your flash that you're using. And in the edges of the teeth, you can build some nice, what we call incisal translucency effects that make teeth look more natural, because in nature, we have translucency in our teeth, although you have to be careful because many patients don't like that. They want more of a uniform color. So this is light reflection. Those are called line angles. When you're doing and working on a case, whether it's a filling or a temporary, the technician is working on the line angles. You're working on it when you do fillings and provisionals. You're trying to communicate to the lab where you want that light to reflect, and you have the ability to adjust and move that. When you look at the edge of a tooth, in this case, we do not have really any incisal or translucency effects added, because that's what Bella asked for, right? So if you look really close at it, you can see that. You can see the texture built into it. You can see that edge of the tooth. It looks pretty uniform. And even at a different angle, the photograph I take allows you to see the texture built into that tooth. But the edges of those teeth are very uniform. Sometimes, again, this is a little different case. You can see a different technician uses different texture on teeth. This is, again, a different case. Different texture is built into it. So when I photograph it, I'm looking at texture quite often. This is something that I just pulled off of Instagram. And you can see in those edges, see that gray area, that translucency, those little halo effects, we call them. You have to be careful if you try to build those into a restoration, even though as a dentist, we like that because it has a cool factor. Patients may not like that because it makes the teeth look unnatural to them. So maybe that's just a dentist thing. Here's a patient that was really a dramatic failure, where the lab tried to build in some translucency and the patient hated it. And I actually went through and tried to remove it. I could not remove that staining on there because it's inside of the restoration. And I actually had to take these off and redo them for the patient to correct it. So working closely with your technician is going to be very, very valuable to you. This is a case I did that was a success. So if you look at the veneers that I put in, we added some translucency and some effects into the edges, because look at the natural teeth next to it. That's what I'm trying to match. So if they already have that in their teeth, you certainly want to be able to photograph it and document it and communicate it and then match it exactly. So that's a really nice, successful case. And when you pick shades, just a tip for you, besides having a good camera, put many shades in one photograph so the lab technician can really try to pick the correct shade and dial in what they see and with their eyes. White aesthetics is pretty simple. It's teeth. That's all it is. It's the teeth. So it has nothing fancy. If we look at Bella, these are some of the fun pictures that we take. I do shoot black and white. And if we look at Bella before, and you can see a lot of the discoloration on her teeth and how that didn't really serve her well being in front of a camera or up on a stage. And you can see what she looks like now and the confidence that she has when she takes pictures. I'll show you a couple other cases before I finish up and why I think portraits are so valuable. This is just 4 teeth. And we do 4 teeth on someone and we get a whole different personality. We get a new personality that emerges from your patients. And I think that's what's exciting to me about doing aesthetics. It doesn't have to be a full mouth case. It can be just a few teeth. And again, if we look, this is actually someone that works for me. And if we look at her teeth, being able to do a multidisciplinary case where we use an oral surgeon, we use a periodontist, we also used an orthodontist to help us. And all I did was 4 teeth on her. I have not finished her case yet because I need to go back and do some of the teeth on the sides, and I haven't gotten there yet. But look at the dramatic change just with 4 teeth that you can do for someone. This is a different person. And then one of my favorite patients, and I think that all of you, will develop this ability to change someone's life. This is just a great case that's one of my favorite to date because she came to us and she really needed some help and we were able to help her. And now look at her smile. That is truly a different person. And you're really changing the way people look at themselves. So when they look in the mirror, they see a different person. And I think you can develop the talent to do that no matter where you think you are now. I know you're not in dental school, but these are the abilities that you may possess that you haven't really had a chance to unleash yet. And so I urge you to kind of find your unique ability while you're in dental school. What do you really like? This is one of my patients. She's deaf. And so we communicated, and I don't know sign language. So she used sign language. We tried to interpret what she needed. And we talked to her with pictures and drawings. And again, this is life-changing for someone. So I want to thank you for your time. And again, I'm going to give you my contact information. Feel free to reach out to me on Instagram, or my email is fine if you'd like, if you ever have any questions or anything that I could help you with. And I thank you for your time, and I'm glad to answer any questions that you might have.
Yeah, thank you so much, Dr. Barrett. That was super interesting. I really enjoyed the presentation, and we do have quite a few questions from our YouTube chat. So our first question is, somebody's saying, I'm considering doing the Navy HPSP to pay for dental school. Do you have any advice for those considering military dentistry?
Yeah, actually, I just wrote a letter of recommendation for someone. So funny you should say that because I just finished it yesterday for the same program. I'm a big fan of that program, and let me just give you 2 different things. I think if you go to the Navy and they pay for school, it's great, but you need to know what you're going to experience when you get into the Navy. You're going to probably give up a considerable amount of income based on what they pay you in the Navy, versus what you could make in a practice, whatever kind of practice you may be working in. And so you have to kind of weigh that cost. The Navy does have control over your life, so they're going to send you and put you wherever they need you to be. And you never know, like I didn't anticipate a war to break out. I had no idea that I was going to end up on a ship in the middle of the ocean for 7.5 months. So you don't have complete control. I highly recommend a Navy as far as clinical experience now. I think their clinicians are excellent. Their education is excellent. But you have to remember, you are first a naval officer, and then you are a dentist. So you're going to do a variety of things that are not dental related. I think it helps you with leadership skills. I think it helps you with time management, things that maybe some of you might need after dental school, that you haven't had a job. So I think it's really good. And I tell people it's really kind of a lifestyle. If you want to do some traveling, if you're, don't have a family, that you're not going to have them move all over the place, or young kids, which most of you probably don't have, it can be very, very rewarding. Just know what you're getting into.
I think that was really valuable advice. Thank you. And our next question is, what has been your experience with teaching as faculty at LECOM? What does it mean to be adjunct faculty?
So an adjunct faculty means that I'm there 1 day a week. So because I have, a lot of offices to look after, we have 150, 190 doctors in our organization that I work with. I don't have enough time to give the school more time than 1 day a week. So I go and I work in their clinic where they're working on patients. I have 10 students in what we call a pod, and they're doing procedures, and I'm guiding them through those procedures. So that's essentially what I do. I do some other lectures in the evening for them on aesthetics, just like I did for you today, maybe photography, things like that, or maybe for their business courses, I help them. So what I notice at the dental school is that everything in dental school takes a long time. What you could do outside of dental school in an hour might take you months in dental school, because you have to get everything checked. It has to be approved. It goes through different committees. And there's a purpose for that. There's a purpose that you're getting the same teaching from different instructors, and that they're following a set of principles throughout their organization. And, they don't want you to hurt anybody. So everything takes time. So it's been super valuable for me to be there and really help to understand, where are you coming when you graduate dental school? I thought that I really had a good handle on it, but this has really made me now kind of get back in touch with that.
Thank you. Our next question is, as a cosmetic dentist, have you had any young patients with primary teeth? If you did, what kind of cosmetic treatments can be done on primary teeth?
So on primary teeth, I don't really treat any primary teeth as a cosmetic dentist. They go to our pediatric dentist. They will do whatever they need to do, a pulpotomy, a stainless steel crown. And rather than having a silver stainless steel crown, they do have them in white. So it can be a little more cosmetic. They do other procedures to help them if there's a broken front tooth. I have in my career worked on very young people who are 11 and 12 that have had really severely fractured teeth in the front from a fall or an accident, where I've done cosmetic work, where I've actually done some veneers, as cosmetic or as conservative as I could be on their remaining tooth structure, but actually doing the same kind of treatment that I would do on an adult. But typically younger than that, I don't treat.
Thank you. And it looks like we have time for one last question. So what is something you would tell your pre-dental self?
My pre-dental self. So, my pre-dental self, you guys, nobody laughed, but, when I was a pre-dental, we didn't have cell phones and we didn't have internet even. So I had no way of knowing what was available in the world, except in the one dental office that I shadowed, and my sister was in dental school. But that was my whole world of what I could see with my own two eyes. So as a pre-dental student, like I mentioned before, I think that you can really venture out, join webinars, follow dentists on Instagram, ask them questions, learn to broaden your horizon, because dentistry is a huge field. And all of us, the practice, do things a little bit different. We find little niches that we like. And you need to really kind of see all of that, because in dental school, and I hate to say this, and I don't mean to say this in a negative way, but your experience is very, very tiny. And there's this whole world. So now you just get on your computer. There's plenty of free CE available that you can join, just like any other dentist, just like I would. And I would partake in it, even if you don't really understand it. you'll start to understand the terminology and the common themes that are there. And so if any of you guys want, I'll recommend a couple of things that maybe you should look at. Just reach out to me and I'll let you know. But that's what I would do.
Thank you so much, Dr. Barrett. That was our last question.
You're welcome. Thank you. And
Yeah.
let me know if I
Thank
can
you.
ever do anything else for you. I'd be glad to help you guys.
Okay. Thank you, guys. I think that's it for today's virtual shadowing section. And I think Quizling also posted on GroupMe and also on Instagram. So be lookout for that. And yeah, see you guys next time. And hope you guys have a great night.